Okay. Well, good afternoon, everyone, and welcome to Public Health's virtual education series, Wazooki Wa'ehi, Family Conversations. I'm Renelle, public health nurse, and I will be moderating today's session. The goal of this series is to gather, learn, and share about Ho-Chunk culture, resources, services, and the connection to health. In public health, we focus on prevention, promotion, and the protection of the health and well-being of our communities. Health and well-being are rooted in many aspects of our lives, from our physical body, our mental health, our spirit, the environment we live in, and much more. During these sessions, we will explore topics that can impact our health and well-being. Together, we will learn about tools and resources to improve our health and the health of our communities. Today, we're joined by Olivia Holman, an intern with UW-La Crosse, to talk about raising heart-healthy homes. We will have about 45 minutes for her presentation, followed by a Q&A. Please use the chat function to enter any comments or questions for our presenter. I will monitor the chat throughout the presentation. You can also come off mute at any time to offer any comments or ask questions. Any questions that we don't have time for, we will forward to Olivia and respond by email. This session is being recorded and will be posted on the Department of Health website and our Facebook page. Everyone, please welcome Olivia.
All right, thank you, Ronelle, for that wonderful introduction. Hello, everyone. My name is Olivia Holman. I'm a community nutrition outreach intern for the Ho-Chunk House of Wellness. I want to thank everyone for being here today. Our session will focus on hypertension, also known as high blood pressure, and how families can prevent it, recognize it early, and manage it effectively. In this session, we will walk through background information on hypertension, youth risk factors and protective factors, and lifestyle modifications. We will add in some adult prevention and end with hypertension management. And lastly, we'll have 10 to 15 minutes for questions. This will be an interactive session today. You will see a few poll questions throughout the slides that you can answer in the discussion chat or unmute yourself. Before starting off with hypertension background information, I want to give a story so that when we go through the slides together, you can have this character or someone you know in mind. Meet Mary. Mary is a 50-year-old and works full-time as a healthcare safety manager. She often works overnight for up to 12 hours as she installs safety equipment in surgical rooms. This work can be demanding, the hours can be unpredictable, and the stress often follows her home. Outside of work, Mary is caring for 2 children and her parents. Most days, she feels like she's running on empty. She feels like she's struggling spiritually, mentally, and physically. Money is often tight in her household, so she tries to buy the least expensive groceries she can find, even when she knows they're not the healthiest options. Over the past 2 years, pressure has built up. Mary went back to smoking to cope with the stress. She knows that this is not a healthy behavior, especially after being diagnosed with hypertension and diabetes, but she also feels like she's trapped in survival mode. She notices her kids are picking up her habits of less movement, relying more on social media, and eating processed foods. Currently, Mary is on daily medication and monitoring her blood pressure. This health scare got her wondering what could happen to her children's health if she doesn't change her household habits. She wants to protect her children's health but doesn't know where to start. Mary's story is not rare. In fact, this can happen to millions of households across the United States. So now we're going to go on some hypertension background. Before starting off with that, I want to go over how to read blood pressure levels. Blood pressure is usually expressed using 2 numbers, systolic and diastolic. Systolic is the top number on the blood pressure cuff, so this would be the number 136 on the left side of the screen, and diastolic is the bottom number on the blood pressure cuff, so this would be the number 89. Hypertension is a condition when a person has high blood pressure. When a person has this high blood pressure, the heart must work harder to pump blood through those arteries in order to get blood to vital organs. A reading of 120 or lower for systolic and 80 or lower for diastolic is considered in range, while a reading of greater than 130 for systolic and greater than 80 for diastolic may indicate hypertension. 3 readings in a row of greater than 130 over 80 are needed to diagnose a person with hypertension. If left untreated, hypertension can cause damage to the arteries, the heart, the brain, kidneys, and eyes, which is why early diagnosis and treatment is important. So now we have our first poll question. Is hypertension asymptomatic, meaning the person does not experience any symptoms from the condition, or symptomatic, meaning the person does experience symptoms from the condition? You can either write your answer in the chat or unmute yourself. Please do not worry about getting this wrong. I just want to see what we already know. All right, so some are saying both, which can be true, and we're about to get into that. So sometimes it can have symptoms, sometimes it can be asymptomatic, and we'll go over that. It is often regarded asymptomatic, meaning it does not have symptoms. This is why it's commonly called the silent killer. Because it is asymptomatic, it's important to get regular screening. Some with undiagnosed high blood pressure may experience further symptoms through further conditions, such as chest pain, shortness in breath, back pain, numbness or weakness, and changes in vision. After a diagnosis of hypertension, physicians may ask about and monitor these symptoms to determine if you may be at risk for cardiovascular events, such as heart attack or stroke. High blood pressure is very common in the United States. While about 120 million people are diagnosed with hypertension, only about 1 in 4 will have their blood pressure under control. According to the 2025 Tribal Health Assessment for Ho-Chunk Nation, chronic heart conditions were the second leading cause of death, which proves that hypertension can be a major risk factor for these cardiovascular and heart disease. So increased awareness, prevention, and management strategies for high blood pressure may help address mortality from heart disease. In addition, according to the National Health Statistics Report from 2023, almost 1 in 3 of American Indian and Alaska Natives have received a diagnosis of hypertension. While studies show a lower prevalence of hypertension in American Indian and Alaska Native populations, the numbers could be higher due to gaps in screening and healthcare access. This stresses the importance of regular screenings and checkups with healthcare providers. To go into more detail, this graph from the CDC shows hypertension awareness. We can see that young adults ages 18 to 39, which is the light blue color on the graph, have significantly less awareness of hypertension compared to ages 40 and up, which would be both of the green colors on the graph. Many individuals in this age group have the mindset of it doesn't affect me, so I don't need to worry about it. Addressing this misconception within our families is essential to reduce the number of youths, young adults, and adults who develop unmanaged chronic hypertension. So who can we protect from hypertension? Everyone. Everyone can play a role in preventing hypertension, and we can do this through awareness and health education. According to Dr. Walker, who works for the United States Department of Health and Human Services, approximately 70% of chronic disease risk is caused by lifestyle behaviors rather than genetics. By increasing awareness and modeling healthy lifestyle behaviors within families, we can help our young adults and children reduce the risk of developing hypertension later in life. Whether a person has been diagnosed with hypertension or are wanting to prevent it in the future, it's never too late to adopt these protective habits. Lifestyle changes can still be reduced the risk of additional chronic conditions and help improve cardiovascular health. So now we have our second poll question. Has anyone ever seen the iceberg model before or have heard of it? Okay, so we have a few yes and no, which is great. I like to throw this model in because it basically helps remind families that if you have a chronic condition yourself or if another family member has a chronic condition, it does not determine their future. There is so much beneath the surface that influences health, including lifestyle behaviors, motivation, emotional health, and spiritual health. This image encourages us to view wellness from a whole person perspective and reinforces the idea that it's never too late to make any positive changes in any area of our life. So now we're really going to focus this presentation on priority of youth prevention. There are two forms of hypertension, primary and secondary in youth and adult populations. We will focus on youth prevention here. Primary hypertension is the most common form of hypertension in children and has no single cause. Instead, it results from a combination of modifiable risk factors such as family history, weight, age, and lifestyle behaviors that we can still change. This is why early prevention and lifestyle habits are important to take part in while young. Secondary hypertension occurs to non-modifiable risk factors, such as underlying conditions. This can be most common for children who have kidney disease. So now we have our next poll question. What are some risk factors that can put your child at risk for hypertension? Whether it's all of them or just a few that you want to list. Yeah, so I see that we're saying majority of all of them, which is correct. About 4% of adolescents ages 12 to 19 have hypertension, and 10% have elevated blood pressure. While hypertension is more common among young and middle-aged adults, it can still occur in youth. Plus, the habits we build as children will typically increase or decrease our risk of hypertension later in life. As we get older, our risk for hypertension can increase among adults ages 40 and up, which is important that we address these risk factors now. It is important that parents have their children assessed by a healthcare provider yearly to address high blood pressure and lifestyle factors that can lead to hypertension down the line. So there's two categories of risk factors, non-modifiable and modifiable. Non-modifiable risk factors are risks that we cannot change. So for example, this would be family history. Now, when we mention family history, it doesn't necessarily mean that if your family member has hypertension, you're necessarily guaranteed to get it in the future. This can still be prevented through lifestyle modifications. Next one is gender. It's often more common for males in both children and adult. And then it's more common in Hispanic, non-Hispanic Black children and adults due to historical and systemic factors that have influenced health outcomes. Modifiable risk factors are those that we can change through lifestyle behavior. In children, we can identify these early warning signs to make lifestyle changes that will help support healthy blood pressure throughout childhood. So this would be weight, salt intake, physical inactivity, if your child's pre-diabetic or diabetic, and if the child seems stressed at home, going through abuse or neglect in the household. For adults, these modifiable risk factors are the same, except we need to watch out for alcohol use, smoking, and high cholesterol. Now we have our next poll question. What are some protective factors for youth? Yeah, so it can be all of these options, but we really want to be careful about our use with over-the-counter drugs. We really want to make sure that they are recommended by a physician before we have our child take them, just because some over-the-counter drugs may have false advertisement. So that's great. So what we can do is prioritize whole foods in our households, make sure that we're getting daily physical activity in, helping improve our children's sleep schedules, and limiting exposure to secondhand smoke. This is great to protect our households from risky substances. Secondhand smoke can cause temporary spikes in blood pressure. Along with alcohol, it can increase the risk of high blood pressure. Parents are often role models for their children and someone they look up to, which is why it's really important to show healthy behaviors and prevent them from using risky substances in the future. But all of these are great behaviors to incorporate in order to reduce any risk of chronic conditions. So now we're going to move on to nutrition. To help prevent hypertension and other chronic conditions, it's important to prioritize certain food groups in our households. For example, we can follow the DASH diet, which stands for Dietary Approaches to Stop Hypertension, and it works for both adults and children. These whole groups would be vegetables and fruits, whole grains, low fat and fat-free dairy products, foods rich in potassium, calcium, magnesium, fiber, and protein. And then we want to limit or be mindful of how much we're having these foods in moderation, which would be foods and added sugars, refined grains, foods high in sodium, and foods high in saturated fats or trans fat. To connect these groups to real life example options, here's some cost-friendly examples that can be found at Walmart. So for vegetables and fruits, fresh options are great, but also canned and frozen fruits are excellent choices to help. They're often more affordable and can last longer in the refrigerator and freezer to help support healthy blood pressure. These groups are a great source of potassium and fiber. For whole grains, choosing a whole grain bread instead of a white bread is a food swap that can help increase that fiber intake and support heart health. And then for low fat dairy, options like low fat milk and yogurt can help provide that calcium and protein. Another great source of protein are lean meats such as tilapia and chicken. And then foods that we want to limit would be our foods high in saturated fat and hydrogenated oils, which stands for like trans fat. For example, whole milk dairy products and fatty red meats can contain around 30 grams of total fat and 12 grams of saturated fat per serving. In contrast, choosing a leaner protein such as tilapia can offer lower fat overall. High saturated fat can raise LDL, which is known as bad cholesterol. This can increase the risk of narrowed arteries. So it's very important that we check our ingredients list on food labels to make sure that we avoid hydrogenated oils. It's important to check food labels for sodium content. Excess sodium can raise blood pressure by narrowing blood vessels and increasing blood volume, which often forces the heart to work harder. And then we discussed implementing whole grains whenever possible. Whole grains can contain more fiber and nutrients that will help reduce the risk of cardiovascular disease. We want to limit our intake of processed meat, such as deli meat or rotisserie chicken. They can often contain higher amounts of sodium, which has been linked to increased blood pressure. And then we want to limit our intake of sugary drinks. These drinks can often contain high levels of added sugars. Sugar additives such as high fructose corn syrup in fruit drinks can create waste products in the body that are known to increase blood pressure over time. And then it's always important to check those food labels when grocery shopping, especially if somebody in your family has hypertension. Understanding food labels can help individuals make informed choices when grocery shopping. For example, the chicken noodle soup label shows 1 cup contains 690 milligrams of sodium, and the entire can can contain 1,510 milligrams of sodium. The DASH diet recommends limiting this to 1,500 milligrams to 2,300 milligrams per day. In general, if you are somebody who would be at risk, this soup of can could be almost close to the daily limit. So it's just healthier to make at home homemade versions of soup. So that way you know exactly what you're including in it. The next two labels just show how it's important to look beyond the front package. You can see the far label on the right just says 10 grams of added sugars. Well, we don't know what kind of added sugars that is unless we look into the ingredients list. And then we can see that it has high fructose corn syrup and know that we should avoid that. Serving sizes can change as children grow. This guideline can help you determine how much to serve your child based on their age. I won't go through every age group on the chart, but I'll highlight the groups that are not shown in the diagram. So if you have a child age 9 to 13, vegetables, girls need 2 cups, boys need 2.5. Fruit, girls and boys both need 1.5 cups. Grains, girls need 5 ounces, boys need 6. Protein, they both need 5 ounces, and dairy, they both need 3 cups. And then for teenagers, ages 14 to 18, girls need 2.5 cups of vegetables, boys need 3. Girls need 1.5 cups of fruit, boys need 2. Girls need 6 ounces of grain, boys need 8. Girls need 5 ounces of protein, boys need 6.5, and then they both need 3 cups of dairy. When we're measuring food with cups, it can be time consuming. So another alternative is hand measuring. So 2 cups would be both hands cupped together. 1 cup would be a closed fist. 3 to 4 ounces would be the size of a palm. A palmful would be a fourth cup. A teaspoon, which would be the tip of your index finger, and then 1 to 2 teaspoons would be the length of your thumb from the knuckle to the tip. These serving sizes change for adults, so it's important to keep that in mind. For vegetables and fruits, we usually have 4 to 5 cups per day. For whole grains, it's recommended to get 6 to 8 grains per day. For low fat and dairy products, it's recommended we have 2 to 3 servings a day. And then for lean meats, it's recommended 6 or fewer. And then fats and oils, 2 to 3 per day. Nuts, 4 to 5 per week. I pulled these meal ideas from Super Healthy Kids, which is a site that provides meal ideas for families. All these meals that we discussed meet the recommendations for the DASH diet. So it kind of just gives parents an example of what my plate or the main whole groups that we talked about can look like for breakfast, lunch, and dinner. Sometimes children can be picky eaters, which I even was a picky eater myself. So incorporating those fruits and vegetables into foods that they already enjoy, like adding fruits into muffins, can make it a little bit easier. For lunch, it's nice to keep this meal lighter and snack friendly. Children are often very distracted during lunchtime with friends and may not finish heavier meals. Some tips for eating healthy is colorful fruits and vegetables help provide children with that essential vitamins they need to grow and develop. And it also has high fiber intake, which can make your child feel fuller for longer. So I like to try to include at least one colorful fruit or vegetable in every meal. Children feel and function their best when they receive nourishment from all major food groups. A helpful goal to go off of is at least 3 food groups in every meal. And then after cooking, or after a long day, cooking and cleaning can feel very overwhelmed and something that we kind of always want to avoid. But families who prepare meals at home tend to eat more fruits and vegetables and have healthier outcomes. So, some things that can help with this are leftovers and also involving the whole family in cooking and cleaning. By letting children be a part of the process of cooking, cleaning, meal planning, writing grocery lists, this teaches them valuable life skills that they'll need later on in life and helps them understand the importance of nutrition. And then the foods that we discussed that should be limited or have in moderation are easier to avoid when they're out of the household. I like the saying, if it's out of sight, it's out of mind. So sometimes by removing those temptations, it can make lifestyle change more sustainable. One resource I want to remind everyone is the free garden at Ho Chunk House of Wellness. The garden is open to community members and provides fresh vegetables and fruits, which is an excellent way to meet those recommendations we discuss. Even visiting the garden can be an activity for families. Children can learn where produce comes from and the process of gardening. Another great resource is the monthly nutrition packets available at Ho Chunk House of Wellness and Ho Chunk Casino. These packets include new recipes to try with families, so that can be an activity, and have important nutrition topics such as portion size, environmental impacts that can be a helpful tool for families. It's really important that we prioritize exercise in our families. When you exercise, your heart rate increases and pumps more blood into the body through blood vessels. By doing this, the body releases nitric oxide that can help lower this blood pressure. It makes blood vessels more relaxed and allowed for increased blood flow throughout the body, which helps improve cardiovascular outcomes. So, the more someone exercises, the increased production of nitric oxide, the more relaxed your blood vessels are. This is important for children because in 2024, it was found that 1 in 4 children meet the recommendations for physical activity, according to the United States Department of Health and Human Services. This number needs to increase because without establishing a routine of physical activity, whether at home or school, children are more likely to remain inactive as they grow older. Research shows that children who currently have obesity have a 5.2 greater risk of having obesity later on in life. So the earlier families can incorporate movement into daily routine, the more likely we are to be able to prevent chronic conditions. So we should really try to encourage children to participate in youth sports, whether this is elementary or middle school, because of the benefits. Some benefits are improved weight, improved cardiorespiratory fitness, lower risk of diabetes, slower BMI increase, and reduced long-term risk for cardiovascular health. Beyond the physical health benefits, it's also linked to support emotional and social well being. Participation is linked to lower rates of anxiety and depression, higher self esteem and confidence, and reducing the risk that they'll engage in unhealthy behaviors in the future. For children, it's really recommended from ages 6 to 17, they have 60 minutes of moderate physical activity a day, such as walking or biking. Majority of children get this within the school day through breaks of recess and stuff like that. So it's really important that when they come home, we try to strive for those 3 days of vigorous activity. This can be through organized sports or running or swimming. And then for adults, we should try to aim for the 150 minutes of movement per week. This can feel overwhelming for adults who work night shift or who work 12-hour days, but breaking this number up can make it more achievable. So it's 6 times a day, 5 minutes of stretching, walking, or going up and down stairs. Some tips for this: daily activity does not have to be time consuming. We can start with a small 10-minute goal, and this could be a small change of taking a family walk after dinner. If you're more competitive in your family, you can make this a competition. So you can track your movement each day and what you want to do, and then see who met their goals at the end of the week. Reducing screen time can often open up more hours for movement. This is easier said than done because everyone can get distracted by their devices, although it's really important because high daily screen time of 4 hours and more is linked to lower exercise levels, less strength training, and higher obesity risk in teens. So some ideas to help this would be create screen-free zones, setting limits such as 15 minutes in the morning, 15 after school, and encouraging outdoor time. I highly recommend that we encourage this in our children. Children are often indoors 8 hours a day through school, and so having them be in a different environment and enjoying fresh air is really going to help with this, and also not have them think constantly, well, when can I get back on my phone? And then using community resources, the Ho Chunk House of Wellness facility offers opportunities for swimming, basketball, cardio, which can help meet those 3 days of vigorous activity we were talking about. And then making sure exercise should never feel forced. We want to make this really enjoyable for children. So any activities they love, make sure that they stick with it because it's more likely they'll do it in the future. And then we have another poll question. How many hours of sleep do you usually get each night? On a give or take. Some nights vary. Okay. So we try to strive for the 7. Hey, okay. You guys are better at sleepers than I am. Sleep is very important because blood pressure normally dips at night during sleep. This dip allows for cardiovascular system to rest and recover. When we don't sleep long enough or well enough, blood pressure may not dip properly, which has been linked to an increased risk in hypertension. How this affects adolescents: well, teenagers who sleep less than their peers are 5 times more likely to have high blood pressure. Many adolescents struggle with sleep due to late night screen time, homework, or inconsistent routines. When adolescents are tired, they often are reaching for energy drinks to stay awake. This can be a harmful cycle because high caffeine intake can cause insomnia, raise blood pressure, and can contribute to the risk of cardiovascular disease. Energy drinks usually contain around 50 to 60 grams of high fructose corn syrup sugar, which is the sugar that we try to avoid. And then excess caffeine and sugar can trigger tachycardia, which is known as fast heart rate. So parents should really monitor if their child seems anxious or restless throughout the day. Some guidelines to go off of is if you have a 3 to 5-year-old, they should be getting 10 to 13 hours. If you have a 6 to 12-year-old, they should be getting 9 to 12. If you have a 13 to 17-year-old, it should be getting 8 to 10 hours. And then adults usually try to strive for 7 or more. If you are an adult with hypertension, you should really prioritize that 7 to 9 hours to give your cardiovascular system a break and have it recover overnight. And then if you're on medications, you should really talk to your provider about side effects. Some medications have side effects of insomnia or difficult sleeping. Over time, poor sleep caused by medications may contribute to a higher blood pressure. Some tips for this is making sure you're on a regular sleep schedule, even on the weekends. The more that we go to bed at the same time and wake up, our body kind of gets used to that cycle and can start doing it on its own. Exercise is great, but when you exercise too close to bed, it can be harder to wind down. We should really prioritize having our children's bedrooms be only used for sleep. Homework, reading, or using their device should be in a different room so that the brain can kind of associate that space with going to bed. We can do this by removing phones, computers, tablets, TVs, anything that can kind of get away of trying to create that dark environment for them to sleep. And then we talked about caffeine use, but caffeine can stay in the body up to 8 to 10 hours. So we should really try to not have our teenagers or even children drink anything too sugary or with caffeine later in the afternoon. Blood pressure in youth can be challenging to monitor because normal levels change as children grow. Unlike adults who kind of have the consistent blood pressure thresholds, children's readings can vary based on age, height, and weight. Because of these changes, it's important that children attend their annual wellness visits so healthcare providers can track their blood pressure over time. And then it's always important to go to your family provider if you have any concerns regarding your child's physical health or cardiovascular system. So, some questions that you may ask are what are next steps to manage and lower their blood pressure? What are some lifestyle modifications my family can make at home? What does the right treatment plan look like for my child? How common or serious is my child's blood pressure at this age? And then what caused this high blood pressure? So now we're going to go into hypertension management. This is for family members who may have hypertension. I hope that we've all gotten our blood pressure monitored at a clinic before, but if you are diagnosed with hypertension, you are often given a blood pressure cuff for safe at-home monitoring. So to kind of go over what this would look like, you want to make sure you are seated in a chair for 5 minutes before taking blood pressure and try to avoid smoking, caffeinated beverages, or exercise within the 30 minutes of taking your blood pressure. You want to place both feet on the floor, have an arm on a table to have your arm at heart level. You should remove any clothing that is underneath the blood pressure cuff. If your physician suggests the use of a certain arm for accurate blood flow, we want to make sure that we use that arm during measurement. We want to try to leave little to no room between the cuff and the skin for an accurate measurement. And then for meaningful comparison, we want to try to measure this under the same time, same arm, or as directed by your physician. Now we have another poll question. Has anyone heard of white coat hypertension or masked hypertension before? All right, so we're seeing a few yeses, which is great. So some people may experience different blood pressure readings depending on environments. Two common patterns are white coat hypertension and masked hypertension. So white coat hypertension occurs when a person has an elevated blood pressure reading in the clinical setting but has a normal reading at home. People can often get nervous around medical environments, and this causes changes in blood pressure. This can overall affect 15 to 30% of patients. And then masked hypertension is the opposite. Blood pressure readings appear normal in the doctor's office, but readings at home are elevated. This can hide the fact that individuals experience high blood pressure during daily life. The individual may be calm in the medical facility, but daily stressors, physical activity, or substance use may raise their blood pressure. This can affect 10 to 18% of people. So it's very important that you attend your annual physicals to keep a yearly track on your blood pressure over time. And just an important reminder that one reading above normal does not determine a hypertension diagnosis. We're looking for 3 readings of 130 over 80 that are higher than that. And then remembering self-monitoring is not self-diagnosis of hypertension. Your blood pressure reading should be shared by your physician to help the provider determine the most accurate and safe treatment plan. The normal levels we're looking for are less than 120 and less than 80. Elevated levels are 120 to 129 and less than 80. And then as soon as we start seeing that hypertension, it's 130 and above or 80 and above. And then some tips for medication use. Always check with your provider before starting a new medication, especially if you're on other medications. We never want two medications to conflict with each other. And then we never want to stop taking a medication without contacting our provider. Stopping our medication out of the blue can be very dangerous and may raise blood pressure. We want to make sure that we're checking with over-counter drugs with our provider's consent because some may not work as advertised and can maybe raise blood pressure. We only want to take medication prescribed to us. And then we always want to reach out to our provider with any changes in symptoms, or if you are taking your medication and you're noticing your blood pressure levels aren't going down, that's a good time to contact your provider. Providers will often go over how you should measure blood pressure throughout the week and how they want you to record it. But some current concerns you can address is using blood pressure medication when I'm on other medications, time of day for measurement and how often I should measure, how I should record my measurement, changes in my recording, whether it increases or decreases, and at-home monitoring of blood pressure if you have a pacemaker. A great resource for monitoring annual blood pressure checks is seeing your physician at the Ho-Chunk House of Wellness. This facility incorporates all aspects of well-being and help provide free resources that will help lower blood pressure. To learn further about what we discussed today, if you have any questions regarding nutrition, two great people to reach out to are Alex Richardson and Kyla Rip, who are registered dietitians. And then if you have any concerns regarding physical activity, you can reach out to Nick Butchart, who is the exercise physiologist at Ho-Chunk House of Wellness. And then our last poll question is maybe unmute yourself or drop in the discussion chat one item that you've taken away from this session. My two are that youth prevention starts now and that we should always go to our annual physicals to monitor our blood pressure. Oh, yeah, that's great that we touched on mask hypertension before. That's definitely something to watch out for. Yeah, sleep is very important for our blood pressure and especially for children, especially when they're young, to make sure that we get the sleep schedules down before they become a teenager and even prioritize that in teenagers. Sorry, so thank you guys. This concludes today's session on chronic hypertension. I hope you've learned something new and helpful. And then if there's any questions related to my presentation or to Alex, who's the dietitian on here at this time, feel free to stick around. Thank you.
Okay, Gigi, Olivia, thank you. I don't see any questions in the chat, but we can take a pause for a little bit, see if anyone has anything. All right. Well, thank you everyone for coming today. Thank you, Olivia, for sharing a little bit of information about hypertension and how we can prevent that in our homes. As a reminder, this session is being recorded and will be available on the Department of Health website and Facebook page. We will not have a session next week as we'll be in Toma for our summer block party. So stop by. We'll be in the cinema parking lot from 10 a.m. to 3 p.m. We look forward to seeing you at our next session in 2 weeks on Wednesday, July 1st. I don't know, it's already going to be July. We will have Dr. Peterson from Ho-Chunk Optical. You can use the same link as today to join all future sessions. To add the recurring WebEx link to your calendar, you can email Jamie and I. I'll put our emails in the chat. We will forward you the invite. And we also would like to hear from you. I'm going to add a link to a short survey to see if there's anything you would like to learn about or if you would like to present. We'd love to hear from you. So thank you, everyone. Have a great rest of your day.